or if you guys want me to roll through them, we got a bunch to talk about tonight.
I don't know. I've got so many I don't know.
It starts with the degree of fluid imbalance required to compromise homeostasis and cause illness.
The one that I didn't finish.
Depends on the patient, size, age, underlying medical conditions. It's D, all of the above. But anyway, number 2, an increase in the size of cells due to synthesis of more subcellular components, which leads to an increase in tissue and organ size, is called hypertrophia. A.
Hyperplasia is more numbers of cells.
Number 3, you had a question, London, or?
Nope.
Her hyperplasia, but.
I'm just saying that's an increase in the number of cells.
Oh, okay.
So just I went through and defined them all.
The boy.
Excellent.
Two of the 4.
When a patient hyperventilates and has carpopedal spasms, this reaction is a result of developing D, respiratory alkalosis.
Yay.
Why alkalosis, not acidosis?
Because that one's I got to go back and revisit. Because you're blowing off
Because
too
pH
much.
is going down, not up.
Exactly.
Other way around.
Alkalosis.
Alkali would be going up, and acid would be going down.
Yeah.
So it's going up.
Oh, okay.
But that's too much CO2.
Yeah. Well, if you're pushing off too much CO2 when you hyperventilate.
So
You can speak up so Ten Sleep can hear you.
So when you hyperventilate, the CO2 is getting pushed off too fast. So your blood pH becomes less acidic because CO2 has a lower pH.
Carbonic type of acid.
Yeah. So if you push off too much of that, then your blood becomes alkaline.
So if you hypoventilate, then you're looking at respiratory acidosis, correct?
No,
Hypo.
alkalosis.
Hypo.
Yeah. So.
Hypo.
Yeah.
Slower breathing.
So yeah.
Oh,
you
okay,
can
excuse
get
me, I said
respiratory
hyper.
Acidosis if you stop
I just
breathing for too
right.
long.
I gotta just remember which one goes with which is my problem.
I just remember that global warming is the oceans are getting more acidic because of CO2 emissions. Same with your body. That's how I remember that.
Okay. Not sure if that goes
Him
with it,
keeping stuff in that he learned from you.
Well, that is true. I mean, that's why the oceans are getting acidic. Too much CO2.
I learned that from Bill Nye.
Oh.
Bill Nye had that, did he? Okay, which of the following is not considered a neuromuscular disease? C, schizophrenia. Would you like to demonstrate that for us? Number 5, a blank is a foreign substance. It's B, an antigen, hence anti. And number 6, blank is an antigen capable of generating an immune response, an immunogen. C. Number 7, when examining rates of disease. Well, why don't somebody else, we'll just trade pages if you want.
I can't read any of these.
Okay, I'll just keep going
I can
then.
do it.
When examining, go ahead.
When examining rates of disease, which of the following terms refers to the number of new cases of a disease in a population in a given time period? I think the answer is A, incidence.
It is. COVID-19, the incident in Hot Springs County is going down.
2. Number 8, common causes of hypokalemia include, and I think it's renal potassium loss,
Absolutely.
which is a low amount of potassium.
Low potassium.
Yes. Hypomagnesemia is a magnesium level below 1.3.
Yeah, I don't know how we're ever supposed to remember that, but
Other places I found said less than 1.25.
yeah.
I made a highly educated, very lucky guess.
I used the answer key on that one because I said I have no clue.
I mean, this is useful for when we run our own blood tests in the ambulance.
Yeah, when that day comes, we'll be ready.
Symptoms of hypermagnesemia include all of the following except, and the correct answer I think is tachycardia.
A, correct.
11, an isotonic fluid deficit is the most common form of fluid loss and is often the result of vomiting.
No.
Sweating.
C, sweating.
Wow, well when I looked it up it said vomiting and diarrhea and said nothing about sweating.
Well, let's take a look.
But I didn't look it up in the book, I looked it up
You
on
Googled it.
the World Wide Web.
Well, let's see what page it's on. It's number
I'm sweaty right now.
number 11, correct?
Yes,
Yeah.
Page 319.
you're turning to page 319. Make yourself useful.
Rude.
I'm getting there as quick as I can. Why would it be different sweating over vomiting?
Because it's isotonic fluid deficit, not dehydration.
So isotonic would mean you're losing
The
sodium
salt.
and water at the same time.
But it's just wanting the isotonic fluid deficit, just the
But that's
salt
why
deficit, not the dehydration.
Fluid deficit, proportional loss, both water and sodium, decreased total body sodium. Vomiting, I don't know if you lose as much sodium as you do sweating, would be my
Yeah.
thought. Diarrhea, the same thing. And they do talk about sweating, fever.
The book very definitely says sweating is the answer, but I
Okay.
guessed.
I mean, I think all of them are.
Yeah, I
they're all
wouldn't-
common causes.
Right, yeah, so it says most common. So online it says causes of isotonic water loss are vomiting, diarrhea, sweating, burns, intrinsic kidney disease, hyperglycemia. Yeah, so they're all a part of it.
So
But
those
most
are all
common,
causes, but the sweating
most
is
common
most common.
appears to be sweating.
I hate it when we do that.
That's the key though, most.
Uh-huh.
Okay, 12, hypernatremia is clinically defined as a serum sodium level of 143 milli something something over per liters or higher. I don't know what those are. I don't know what an EQ is.
143. That's it.
Yeah, and elsewhere I found greater than 145 was a number that they said.
What was another number that was given?
Causes of hypercalcemia include all of the following except, and I found the answer to be D.
Alcoholism.
Is that correct?
Uh-huh.
Yeah, that's what I had.
So antacid ingestion, we talked about that. I kind of remembered us talking about cancers in one situation, but then a diuretic, if you're getting rid of fluids, that can make it go up. 14, which of the following is a sign of respiratory acidosis?
So that would be F.
That pH goes down, you're keeping excess CO2.
Yeah, I would say bradypnea. Bradypnea.
Brady, which one is that?
I think it's a D.
A,
A.
It's A?
And I'm not sure how to pronounce it. I was gonna look it up.
bradypenia?
Right, yeah.
Yes, yeah. How do you say
Bradypenia?
it?
Bradypnea. Yeah, I call
That's
it
what I thought.
tachypnea. Is it like
Right.
Tachypnea.
Yeah.
Be
I
the
mean-
be the opposite of that.
Yeah.
Real slow breathing.
I guess I should have looked at the answer sheet when I was writing these down.
I didn't look at the answer sheet either.
I cheated. I looked at it.
I didn't print it off.
Okay, 15. All of the following are factors associated with upper gastrointestinal losses that can lead to metabolic alkalosis, except, and I put A.
Well, I think
It's gonna be C because
C
it's
because of upper.
Upper, yeah, that makes sense.
So is that diarrhea?
Yeah.
That leaves diarrhea out. Yeah, C. I'll get the next one, then I'll swap with you again on the next page, London. The inflammatory response can be triggered by an agent that is physical, chemical, or microbiologic.
All of the
Or
above?
All of the above, yes.
Mild.
17, an abnormal gene may develop in a person as a result of mutation during meiosis, by heredity as a result of other causes later in life.
All
So
the
D,
above.
yep.
Weird.
I don't
So
think
what's an
18
example
is.
of other causes later in life? That's the one that
Exposure
threw me.
to any kind
Yeah,
of,
radiation or
what's the word for something that causes cancer? I'm blanking on it.
Carcinogen.
Carcinogen.
So, yeah, and radiation, any of those things that will disrupt
All
your
right.
genes.
Cell division and stuff.
Prostaglandins are found in many vertebrate tissues where they act as messengers. And in reproduction, in inflammatory response to infection, and pain perception, D, all of the above.
It is all of the
Your
above?
head.
Yep.
The reproduction through me.
So that comes, prostaglandins show up during labor.
You've lost
She's not listening to my answer.
Thank you.
Brennan, just in
prostaglandins
time,
are
man. We're
important
going
to
over the
initiate
reviews.
labor.
She was referring to the haircut.
Which I had to go look that up. I was like, what do these have to do with
Okay.
labor?
I
With
didn't look
reproduction,
anything up.
it's just because of they are part of labor.
In response to hyperperfusion, the body releases
Catecholamines.
catecholamines, epinephrine and non-epinephrine, which produce increased strength, cardiac contraction, increased pulse rate, increased systemic vascular resistance, D, all of the above.
It is all the above. Keep
Yeah.
expecting one of them.
Almost
not
every
to be.
time where it says all of the
There
above,
will be a
Amy,
chance.
except with a couple of exceptions, it's all of the above.
But it's
I thought
very,
these
it's
were
very
some-
obvious though when it's not all of the above.
Yeah, cardiogenic shock occurs in ischemic heart disease when there is a loss of C, 40% or more of the functioning
I guessed.
myocardium.
My swag didn't get it done.
21. Blank refers to the total number of cases of a disease or condition in a particular population within a particular year. It's B, prevalence.
Oh.
I, for some reason, wanted to put incidence down. 22. Morbidity refers to the damage or suffering caused by a disease, either in an individual patient or in the population as a whole.
Really? I probably should read that chapter.
23. Mortality is the number of deaths from a disease in a given population, expressed in proportion. 24. Asthma is a chronic inflammatory condition of the lower airway resulting in intermittent wheezing and excessive mucus production.
Sucks to your ass, man. Did you know that?
25. Distributive shock occurs when there is a widespread dilation of the resistance vessels, the capitance vessels, or both. 26. Spinal cord injury may cause B, neurogenic shock. Which of the following is not one of the immune system's lines of defense? It's B, the acquired response. 28. Acquired immunity is a highly specific, inducible discriminatory method by which armies of cells respond to an immune stimulant such that the immune system will never fail to recognize the same stimulant when it is subsequently encountered even years later.
Did you know that I just learned about this. Did you know that your humoral immunity is like your skin and your mucous membranes?
Mm-hmm.
I didn't.
I didn't either.
It's pretty cool stuff.
There's another question in here that asks about that.
I think
Oh.
so, yeah. You didn't look at my emails, did you, Tyler?
He knows the answer. You might as well just tell him the truth.
Definitely not. Sorry.
29. Cell-mediated immunity is characterized by the formation of a population of lymphocytes that can attack and destroy foreign material. 30. Inso-immunity is the formation of T cells or antibodies directed against antigens on another person's cells, typically after the transplant of an organ or tissues.
So that must have a different name somewhere else because the internet doesn't recognize that as a word.
Iso-immunity.
It
Yeah.
doesn't? Oh.
I looked it up and I was like, I spelled it right.
It's a secret EMS word, apparently. I hope to God it's not on the test.
What page is that on, Jim?
You're going to ask hard questions.
That's number
32.
32.
32, page 554. Or no, wait, that's the wrong.
It's 31, sorry. No, 30. Number 30.
It's number 30. Hold on.
Find the page.
Find the page. This is
Page
your book.
345.
We're almost there.
Does it
Pitter patter. Yeah. Oh, no, it's fine.
31. Oh, whoops, 32. 31, I'm sorry. You asked 31.
No, it was 30, you were right.
But which one is 30? What was
They're
the
both
one?
on 345.
That iso-immunity, I just wanted to see if in the book it talked about a different term, but I don't see that it referring to some other term.
31. Autoimmunity is the production of antibodies or T cells that work against tissues in one's own body. 32. Social and psychological effects of obesity include all the following except A, a positive self-image, unless you're in the NFL.
Depends on who you are.
33. Which of the following is not considered a neuromuscular disorder? Schizophrenia, again, that seems to be a favorite of them.
Wow. Nice. I like that you picked them all off.
34. Concepts related to physiological stress include
Is it
D,
D?
all of the above. The stressor, the effects of the body, and the body's response to stress. 35, gout is an abnormal accumulation of uric acid due to a defect in metabolism.
That's the King's disease.
36, D, all of the above. Allergic rhinitis, bronchial asthma, wheal and flare is considered a mild hypersensitive reaction.
I had to look that up, wheel and flare again. It meant something important.
37, Graves' disease is an autoimmune disease caused by thyroid stimulating or thyroid growth immunoglobulin. And 38, treatment for cancer depends on the type, the site, the extent. D, all of the above. True, false. These are fun. Hyperperfusion occurs when the level of tissue perfusion decreases below normal. That is true. Number 2, hypocalcemia can be caused by endocrine disease. That is true. 3, the clinical manifestations of edema may be local or generalized. That is true. Number 4, sodium is the second most abundant intercellular cation after potassium. That is false.
So is sodium not the second?
Yeah, the answer,
Calcium, isn't it?
I think it's calcium, but
But potassium is the first.
oop, I don't have my answer key on that one. How did I answer those? I must have looked them up. Number 5, ketoacidosis is associated with insulin deficiency or desensitization of cells to insulin. That is true. Hence that fruity smell in their breath. 6, long-term ingestion of lead. Don't quit eating lead, Tyler. Such as that caused by chewing on windowsills painted with lead-based paint leads to brain injury and neurologic dysfunction. That is true. Number 7, zagites are red blood cells that engulf and consume foreign material such as microorganisms and cellular debris. That is false.
White blood cells.
White blood cells, yeah. Apoptosis can be activated prematurely by pathological factors such as cell injury. That is true.
Apoptosis is cell death, right?
Yes.
Right. Apoptosis. Number 9, the acute inflammatory response involves vascular and cellular components. That is true. Number 10, when hypoperfusion overwhelms the normal compensatory mechanisms and the patient's conditions progressively deteriorates, this is called compensated shock. That is false.
Decompensated.
Decompensated, yeah. Number 11, endogenous hypovolemic shock occurs when the fluid loss is contained within the body. That is true. That third space loss. Number 12, septic shock occurs as a result of a widespread infection, usually fungal. That would be false. It wouldn't be typically fungal.
Bacterial.
Bacterial, yeah.
15% of it is fungal.
And number 13, a normal capillary refill time is less than 4 seconds after blanching of a toe or finger, whereas a person in shock may have a capillary refill time of greater than 4 seconds. That is false. I think it's like
2 seconds.
2 seconds, yeah.
We don't really check for cap refill on adults, do we?
We do think they're going to get shocky, yeah. Good way to look.
Okay.
Where would you look to check that? Yep. What happens if they're got their fingernails painted?
Use your tongue.
You chop their fingers.
Chop their fingers off. Yeah, you might be able to check earlobes sometimes. You can kind of take a peek at that.
You could probably
Just turn the finger
over. And
They suggest removing the nail polish in the book.
We don't have time to do that.
Yeah, it's like,
It's fine.
let me get my nail polish remover out.
Always carrying
You can
acid.
still like press on your thumb and it does the same.
Yeah, and your thumb also.
Close enough. Think about it.
Okay, chapter 12.
That's one I don't have.
Right, finish this one.
The fastest way to deliver a medication is by what route?
Intravenous.
Yes, A, intravenous. Number 2, the phase of clinical trials in which a drug is made available to a group of patients is phase 3, C. Insulin is a medication that is given by which route?
Intramuscular.
C, subcutaneous.
Really?
That's what
Yeah,
they said.
it totally is.
My friend gave her shots in the arm.
When I had to give a cat insulin at the vet clinic, it was
Usually in the
always,
stomach.
Darn it.
not in his muscle.
Usually in the belly.
Maybe
In
did
the
hers
belly?
in the arm.
Yeah, I always heard the.
I could probably do mine in my arm, but not everybody can.
That was the first time.
I just lost 10 sleep.
She,
Uh-oh.
I fainted, I was holding her arm and looking away and I fainted, seized it.
Most people do their insulin shots in their belly fat.
Okay.
Yep, that's kind of the preferred spot. Number 4, the blank monitors drug advertising and ensures it's not misleading or inappropriate. The
FDA?
FTC.
I didn't think that.
It's the advertising,
Yeah, the advertising portion is what gets it.
Federal Trade Commission.
Number 5, the form the manufacturer chooses for a medication ensures proper route, timing of its release, and effects on the target organs or body systems. The correct answer is D, all of the above. Number 6, nitroglycerin relieves the squeezing and crushing pain associated with angina by doing what? The correct answer is A, relaxing the walls of blood.
Blood.
It was not all.
I got that one right.
Yeah, it doesn't make the heart contract harder and increase cardiac output. Doesn't cause the heart to necessarily beat faster to supply more oxygen to the heart. Number 7, solutions may be given how? Well, orally, intramuscularly, rectally, and all of the above. So D is correct. I haven't given any of that route C ever. 8, preparations in which substances have been ground into fine particles and evenly distributed throughout a liquid by shaking or stirring, known as B, suspensions. Which is true of subcutaneous injections. Medications absorb more slowly. Effects of the drug last longer. They would not be appropriate for patients with decreased peripheral perfusion. Why not?
Cause
Because it won't flow.
get through
The blood flow?
bloodstream.
Yeah, you never would get moving.
I would say D.
It's D, all of the above. Number 10, the blank is the primary organ for biotransformation. C, the liver. Number 11, organs of excretion include kidneys, intestines, lungs. Why lungs?
CO2.
CO2, you're blowing off, right? D, all of the above. Number 12, medications have been identified or derived from vegetables, animals, minerals.
All
D.
All of the above. D. Yeah. 13, an allergic reaction to a drug occurring after a previous exposure to the drug is called B, hypersensitivity. Interestingly enough, a lot of times the first time somebody takes something, it doesn't bother them.
They haven't developed antibodies yet.
Exactly. Then the second time they get it, they've developed antibodies, and then you get the allergic reaction. 14, fentanyl is a what type of drug classified by the DEA?
It's a 2.
It's a 2.
I gotta review that stuff.
Well, if it makes you feel any better, I didn't have a clue. I had to look it up.
That one, I figured that one out because fentanyl is just as dangerous as all those Schedule 1s, but it has a therapeutic.
So Schedule 1
Yeah,
is a
exactly.
So that popped it
Yeah.
into 2.
Schedule ones have no medical use.
Me too. That's
Allegedly.
why I said
Cause I was thinking, I put,
Like-
Marijuana is still there.
I put behind it, so it's, I remember it's backwards then.
You never know. We had a weird one this summer. We had a call up Grass Creek.
No pun intended?
No pun
Just a little
intended.
bit of fun.
And yeah, well, we go up to Grass Creek, and some young people were traveling cross country, and they went down through Denver and stopped and bought apparently some legal marijuana. in different forms, I guess the good stuff or whatever. And
Oh, I was on that call, I
Yeah.
remember that, yeah, I remember that.
and one of the individuals decided to partake of it. I think they all had partaken of it at some point.
But they were edibles, if I remember right.
I think
No, that man smoked, you could
Yeah,
smell
he
it.
said he smoked.
Oh,
That wasn't
okay.
edibles.
But I think one of those.
Brennan,
things
do you know
that-
what type it was that he bought?
Apparently some really strong stuff. I almost asked him what store it was, like, it sounds like you're having a good time.
It was the kind that was legal till it hit the state line.
Yeah.
Or, yeah, yeah.
But it really had him, remember,
Yeah, he
seizing
was-
and
he was
the
out
whole
of it.
bit. He was out of it.
I just wondered if he didn't.
For something that's harmless, it didn't look real harmless. Now, maybe he'd taken something else. I don't
Could've
know.
been. I
He said
thought
he
I
was
remember
drinking
them
too,
saying that
but
they had some
still.
edibles as well though, and they thought he had some of the edibles that the others had not had.
Oh,
Should be
well,
pretty
I know
clean
for
if they
sure
get it
he
from the
smoked
store.
because you could smell it on
You could
his breath.
smell it on him, yeah, I remember that after.
I
you
could
said
smell it when I walked to the car.
It smelled like Mile High Stadium for some weird reason.
Yeah, man.
Anyway, it's interesting. It's a Schedule I drug, maybe for a reason. Who knows?
Well, they've been using that to help people that are, taking, chemo for years, right? To help them deal with their nausea.
Yeah,
and-
but
and
I've
increase
often
their
wondered,
appetite.
Dan, what the percent of THC in it is. I mean,
Well, but if they're giving it to them for that reason, there's a therapeutic purpose. That alone should tell you it shouldn't be a Schedule I.
but you could also take Finagrin or a variety of other things for that. I mean,
But the idea of Schedule I is that it has no therapeutic purpose or value.
cocaine.
And if they're giving it,
Cocaine's a Schedule I
is it?
or Schedule II.
Schedule II, it's
Yeah.
still, it's a Schedule II.
I think I remember him saying that last
Yeah,
time.
cocaine
we met,
Schedule
but-
2, they use it in eye surgery and.
Yeah, could
Yeah.
Yeah, as long as it has a therapeutic purpose, that bumps it down one.
Anyway,
Okay, that's good to remember that.
15, blank is the risk that a substance will pose a health hazard to an individual or organism. It's C, toxicity. 16, the blank was the first federal legislation in the United States aimed at protecting the public from mislabeled poisonous or otherwise harmless food, medications, and alcoholic beverages. A, Pure Food and Drug Act. 17, when treating pediatric patients, medication dosage is usually based on a child's A, weight. 18, extrapyramidal symptoms may include all the following except B, voluntary movements. In elderly people, D, they can have all the above. Hepatactic function slow, gastrointestinal activity slows, absorption is delayed. Number 20, drugs or medications can be classified by body system, class of agent, mechanism of action. D, all of the above. 21, the proper dosage of medication depends on all the following except C, generic substitutions. 22, the blank, the parasympathetic nervous system relaxes the body. 23, there are currently no drugs in this category that are within the scope of practice of the AEMT. And they benzodiazepine, barbiturates, non-barbiturate hypnotics. Suppose that'd be LSD. I don't know. Correct answer is D, all of the above are not in our scope of practice.
My,
We don't get good people
stapling
unless-
skills, that get it done.
Only if
Upside
it's in
down.
food.
I pulled that one out, Tyler. I don't know, am I correct? I'm just guessing.
I don't know.
24, beta blockers compete with A, epinephrine to bind with available receptor sites, thereby diminishing the effects of beta stimulation. 25, vitamins and minerals are necessary substances that allow for normal metabolism, growth, development, cellular function. D, all of the above. The brand name that a manufacturer gives to a medication is called the A, trade name.
Ambien, Lunesta, Sonata are examples of non-barbiturate hypnotics,
Oh.
sleep medication.
Oh, that wasn't what I was thinking.
Yeah, wasn't what I thought.
Less
either.
exciting than.
Liturgic acid.
Yes.
27. What affects the potency of medications? Temperature, light, moisture. D, all of the above. 28. Autonomic nervous system controls all the automatic or involuntary functions. 29, the duration of action, A, is the amount of time a medication concentration can be expected to remain above the minimum level needed to provide the intended action. 30, chronotropic effect is the one that affects the heart rate, that's D. 31, dromotropic effect occurs when the drug alters the velocity of the conduction of electricity through the heart. I didn't know that one. 32, introtropic effect changes the force of contraction in the heart. Oh. 33, sodium channel blockers slow the conduction through the heart. 34, calcium channel blockers block the inflow of calcium into the cardiac cells, D. 35 is C, potassium channel blockers increase the heart's contractibility, or contractility, excuse me. 36, cardiac glycosides block certain ionic pumps in the heart cell membranes, which directly increase calcium concentrations, A. 37, osmosis is the movement of a solvent from an area of lower solute concentrate to an area of higher solute concentrate. 38, a idiosyncratic reaction is peculiar or individual reaction to a drug. 39, a medication interaction occurs whenever the actions of one drug on the body are in some way modified by another chemical substance. C. 40, the termination of action is the amount of time after the concentrate level falls below the minimum level to the time it's eliminated from the body, A. 41, with a cross-tolerance, a patient can develop a tolerance to other drugs in a certain class as a result of prolonged administration of another medication in the same class. 41 is B. Questions? That Dan did a super job. I just wish I understood all of it.
Oh, yeah. That guy.
Yeah.
That guy.
The other Dan.
Other day.
What?
The other Dan.
Taller Dan.
Look at you two. God, never mind.
I was not the one who did the fine job.
13. You guys want me to go through that one quick, or?
Sure.
I don't like those matching ones.
Yeah, that was really a bad call on me, on my
I'm
part.
curious to see how I did.
Okay, you ready, Amy?
Yeah.
You go for it, girl.
Oh, I'm reading it?
Yeah.
Are we doing matching?
Okay.
Yep, matching first.
So number 1, a crystalloid solution. I put C, contains molecules that are too large to pass through the capillary membranes. I don't know if that's right.
They said J.
It's J.
J.
A solution that contains compounds that quickly dissociate in the solution.
Good start, Amy.
Hey,
Okay.
you're
so
trying.
B, a phospholipid bilayer is the cell membrane's double layer.
Excellent, yes.
Yeah. 3, I put I, maybe, a charged atom or compound.
Absolutely. I is correct.
4, interstitial, I put Q.
Yep.
Water outside the vascular system and between surrounding cells. 5, normal saline, I put N, a stereocrystalloid isotonic.
No, they had J.
J.
Solution that
How do
contains,
you use J?
Wait, no more saline? That's V. Like
or not, V, I'm sorry. 9% sodium chloride is normal
Okay.
saline. My error. My V looked like a J. Sorry.
Okay, so micro drip, I missed finding the answer to that one.
Macro drip.
Macro
6
drip.
is A.
6
Allows
is
for
A.
rapid fluid flow into the vascular system.
Ah, okay. So 7, I put V, so that's wrong. So is
H.
it
It's H.
H?
5%.
Yep, 5% dextrose in water,
All of
hence
those fluids I wasn't
D5W.
sure about. Sclerosis I know is W, hardening of the veins
Yep.
and scar tissue.
Excellent.
Bolus, I have a question mark, I put G. amount of
That's what I
fluid in an
put
IV
too, but
bag
it's
or.
not.
They had, and I didn't get this
I know
one
it's a
either.
large amount.
They had one mass in one mass.
One mass,
Oh.
so that
But I had
is
put G too.
P.
P,
And I had to look it up to find it because I missed it.
How did it get that?
yeah. A nebulizer is K.
Yep. A device for producing a fine spray or mist.
Sodium potassium pump, I put Y, mechanism by which the cell brings in two potassium ions and releases 3 sodium ions.
Excellent.
Osmotic pressures, T, pressure created against the cell wall.
Wow, you're on a roll.
Intravascular, I put A, I know that's wrong now, so,
It is L. Water portion of the circulatory system surrounding the blood cells.
okay. Colloid solution,
How did
I put J, that's wrong, so,
C.
okay. I knew
Contains
all-
molecules that are too large to pass through the capillary membranes.
So all my solutions are wrong. My guesses were not getting it done. Homeostasis is X, the balance of all systems
Yep.
of the body. Ionic concentration, I put M, the amount of charged particles found in a particular area.
Right on.
Local reaction, I put E, mild to moderate allergic reaction occurring in a localized area.
Excellent.
Volume on hand, I put P for the question mark in one mass, so that's wrong.
Yeah, they had G, the amount of fluid in an IV bag
I got
or
those two
vial of
backwards
medication.
then. Alright, third spacing, I put Z, shifting of fluid into the tissues, creating edema.
Super.
Oh, that was a guess. Selectively permeable as S,
Yep.
allowing compounds in the cell based on the cell's current needs. Microdrip, I put O, allows for careful control of fluid flow.
Yep.
Contaminated stick, I put D. Puncturing of an emergency care provider's skin with a catheter that was used on a patient. And then embolus, I put R, presence of air in the veins. Acidosis, I put U, result from an accumulation of acid in the body. Lactated Ringer solution, I put H, and that's already been used, so all my
It's N.
solutions are wrong, and.
A sterile crystalloid isotonic IV
And
solution.
flash chamber, looks like that's an F. I'd be yelling at me if I were my students. Fills with the blood to help indicate when a vein is cannulated.
Excellent.
Good job.
Well, you tore them up.
Obviously need to review my solutions. Alright,
Okay, second part, matching part 2.
am I still going?
Yeah, if you want
And
to.
cubital, I put K.
Yep.
Anterior
aspect of the
aspect of the elbow. Venous thrombosis, I put X. Accumulation of blood in the tissue surrounding an IV site.
They had R, development of a stationary blood clot in the venous
Alright.
circulation.
So maybe what I put for R would be X. I'm gonna see if I just switch those around. Okay, pulmonary embolism is I, blood clot in the pulmonary circulation.
Yep.
Butterfly catheter is double D.
Yep.
No, it's a character name. It's a character.
Sure.
from that.
Whatever.
Nice save.
Concentration, I put W, the total weight of a drug containing a specific volume of liquid.
Yep.
Ions, I put C, electrolytes. Right?
Yep. Absolutely, Amy.
Metabolic is Y, relating to the breakdown of ingested food stuffs into smaller and smaller molecules and atoms.
Yep.
Administration set, I put B. These
Yep.
are, I wasn't good at these, I guessed. Alkalosis, I put V.
Absolutely.
Accumulation, okay. pH, I put S, acidity of a solution.
Yep.
Ataxia, I put U.
It's
That's the gate thing.
it's a staggered walker gait.
Okay, those were all guesses, so. Guess I
Well,
probably.
you're tearing it up so far. You only missed a couple.
Where's
I
the
knew that was
gate?
being
Which
run
one is
over.
that one?
N.
N? Okay, so I'm just, maybe S is, okay. Hypercalcemia is A.
Yep.
Intravascular, I put E, the water portion of the circulatory system surrounding the blood.
Yep.
Cellular perfusion, I put double A, the ability of the cell to take in oxygen and remove carbon dioxide.
Yep.
Hypokalemia, I put H, low potassium levels. Buffer, I put F, controls hydrogen levels in the solution. Polyuria is the excessive peeing. L.
Yep. I have that trouble
Oh.
periodically.
Or orthostatic hypotension is T, symptoms where your blood pressure drops when you stand up or change position.
Yep.
Tachycardia is double C, rapid heart rate above 100 beats per minute. Access port, I put Z, sealed hub on the bottom of each IV bag. Is that right?
Yep,
Yeah.
you got it?
Good. I wasn't sure about these. Drip set, I put J,
Yep.
also known as administration set. Drip chamber, I put D. Area of administration set where fluid accumulates to keep the tubing filled.
Mm-hmm.
Piercing spike is M. The hard sharpened plastic spike at the end of the administration set. So I'm gonna say trocar must be U,
Yep.
the solid boring needle. Fascia is double B, fiber-like connective tissue. Hematoma is X. Osteomyelitis is G. Do you want me to keep, do you want me to
Yeah,
read
you're
G?
almost done. You're doing
G
great.
is inflammation of the bone or muscle. Osteogenesis imperfecta, I put Q. Congenital disease resulting in fragile bones. Desired dose, I put O, the amount of medication the physician orders. And intranasal is P.
Within the
Within the
nose.
nose.
Nice job.
Excellent.
I'm just keep
Man, you
my
rock
finger
those.
on that.
Thank you.
Ready for the multiple choice now?
Sure. Hypocalcemia can lead to, I put musculoskeletal cramps.
Yeah, C.
Good. Signs and symptoms of dehydration include B, poor skin turgor.
Yep.
Avoiding attempts to insert an IV in an extremity if D, all of the above. It shows signs of trauma, injury, or infection, has dialysis fistulas, is on the same side as a mastectomy.
And that's one to, I guess, to ask more often.
They're usually good about telling you, but I feel bad when I don't ask first.
You also don't wanna do a BP on that arm.
You don't want to do a BP on that arm either.
Nitroglycerin is administered SL, which means under the tongue or sublingual. All of the following are local reaction problems associated with peripheral IV insertion, except I put air embolus
Yes.
because it's not local.
Yep.
6, what can be infused through an intravenous line
Interosseous.
or interosseous? I put D, the fluids, medications, and blood, but
Yep.
that was a swag.
No blood.
No.
No blood?
What?
So-
Blood?
They've got blood here too.
Fluid, meds, and blood.
Yep.
Cool.
So my flag worked?
Corroboration with the internet.
Alright.
Said
And-
blood was very uncommon.
MDI.
You know, you're probably right, London, but apparently, you know, think about it, it's where the red blood cells are made.
Right. I just didn't know that it would get where it needs to go
Uh-huh.
very
Quickly enough.
Yeah, you just said they very uncommonly used for.
I would guess if it's all you had.
Right.
Alright, so 7, MDI is meter dosed inhaler D. IO lines are contraindicated with cardiac arrest, status ellipticus, and a fractured tibia, so D, all of the above.
Nope.
No,
C.
damn!
I thought it was
just have a
D2.
fractured tibia.
Well, that, I circled C and went, so,
I
No,
thought,
so
you
the only
know,
time we've tried an IO is with cardiac arrest is when I didn't know
Okay.
I looked at that and that's the one that kind of
that makes
surprised
sense.
me.
I
I
should
thought,
have
well,
thought that one through. I should have thought that one through. I didn't know what status ellipticus was other than death.
You're having a seizure.
Oh,
Seizure.
okay, epilepticus.
might be the only time you can really get that baby in there.
Yeah. Hold still.
Well, they're thrashing around.
Don't go anywhere.
Local reaction to IV therapy would be, I did catheter shear D.
They have B.
Colitis.
Okay, I didn't know that, what that
Colitis.
word meant, so,
Interestingly enough,
Inflammation of the vein.
that number 8's the only one that's not D, all of the above, that was shown as D is all of the above. And I told you at the start.
There had to be
No, there-
one.
there was another one.
Thank you.
Was there another one
There was
back?
two of them,
Okay.
yeah.
That was the one I was thinking of that.
One of the causes of dehydration, I put hemorrhage,
Yep.
C. 11, all of the following are systemic complications of IV therapy except, I put infiltration.
Yep.
12,
Because it's not
which
systemic.
is not a basic unit in the metric system, it's milliliter, because it's a smaller fraction of it. 13, which of the following routes is not considered peritoneal?
Peritoneal.
Peritoneal. I put rectal.
Yeah.
Okay, good, it was a swag. Subcutaneous injections are usually 1 milliliter or less, are performed using 24 to 26 gauges, 1/2 inch to 1 inch needles, and are administered in upper arm, anterior thigh, or abdomen. I put D, all of the above.
Yep.
15, blank are always, are a way to maintain an active IV site without having to run fluids through them. That would be a saline lock, B. The fastest route of medication administered for an AEMT is, I put intravenous, D.
Yep.
Signs and symptoms associated with infiltration include edema in the catheter site, continued IV flow for occlusion after the vein above the insertion point, and patient complains of tightness and pain around the IV site, so D, all the above. IO lines, use IO lines when you are unable to gain IV access in blank in critical pediatric patients. I put 2 tries at 60 seconds, but that was a swag.
They say 2 tries in 90 seconds.
90 seconds? Okay.
We used to have, and I don't even think we carry them on the
You
ambulance.
can do 2 tries in 90 seconds is my thought.
I thought tries.
That was correct answer,
With
B.
an IV.
But I don't even know where we've got the little infant IO
Well, define 2 tries.
needles
right?
anymore.
Everything's set up. And
You know what, if
So,
you're
like-
unconscious, why would you not just keep trying?
If somebody's looking at me, it might to them seem like 1 try, but to me it's like 10.
I guess my question is,
You're drilling.
You just can't stop this from happening.
what would make you need a line that quickly for us?
Well, it says
It's a
critical
pediatric patient.
patient.
Critical, so you're gonna
So
try to
a kid
give them
that's
some
crashing.
volume, but you gotta be careful when you give a peds patient volume.
Yeah.
I'd say probably like maybe a femur break, car crash, something like that, where they're
Okay,
obvious, losing fluids.
all right, could you do an IO distal to a femur break?
No,
No.
I don't think so.
Distal?
Because it wouldn't get the circulation you need.
It might not get through the break.
Then you
Exactly.
gotta use the sternum for.
Well, you can use the
Yeah.
upper leg.
I don't think you can use a sternum
You're right.
A little kid would,
in a peds, I think that's not recommended. Have to look at that one, but I don't think you recommend it for an IO in the sternum on a peds.
got 2 legs, hopefully that'll.
Check that one, but
Did you say sternum?
2 places, 3 places are here, here.
In the break.
It's Sturman.
I think with kids though, it's so small, I don't know.
Yeah, I don't know. I don't know what pediatrics is.
I don't know if I'd shoot for the sternum.
Not with a
I'd
kid.
be afraid of punching through it.
The IOs that we
That's
used to
okay,
have
I'll
for
get on the try.
peds were smaller, you could put them in by hand, you could pop them in. We used to practice on chicken legs.
Are we gonna
Really?
get to practice IOs?
No,
Right now, we got a problem.
Why?
Me.
I don't have
Um,
any IOs.
well, no, we've got IOs, but they're
Battery
all
and the
good
guns fail.
IOs, but the batteries and the guns are,
We need to just order ones that are handheld.
I have
well,
a saw and a.
I'm gonna get with Brennan, we're gonna see if we can modify a
Make it work.
DeWalt and see if we can get a practice one and modify a DeWalt to drive it.
That feels.
I'd
Sounds
like to
something
try
we
to
should
just
get
push
on.
one through a
Maybe
hand bone without.
Milwaukee.
Milwaukee, okay, I don't care.
Bet you there's an
I'd like
adapter
to
you
check,
can
try to
pre-print.
just push one in on a hand bone to see if it's possible.
Get it, kids.
Alright, where did I leave off?
We don't know.
19.
19.
I didn't
Common
touch-
signs
I
and
grabbed-
symptoms of
I didn't
allergic
grab
reaction to.
Two that looked like they were in the charge stack and just ran.
Oh, so
I saw you
there is a Milwaukee battery adapter for an IO. Let me see if I can find that.
I saw
Really?
you.
Let me. It looks like there might be one that we can.
Okay.
Alright, are we ready, kids?
Yeah, let's go for it.
A common sign and symptom of the allergic reaction to IV therapy include all of the following except, oh, shit, I didn't read that question right. I put itching. That's not right.
It'd be C.
C, hypertension. I'm
Hypertension,
sorry,
yeah.
I did not read that carefully. Oh, my bad. I'd be yelling at me if I were my student. Documentation after administration of medicine should include name of the drug, dose of the drug, and route administered, so D, all of the above. 21, as soon as possible after drawing blood, label all the tubes with the patient's name and the date, the time, and your name, so D, all of the above. Intramuscular injections are C, given at a 90-degree angle. If cannulation of an artery occurs, you must A, stop at IV administration, B, remove the catheter, C, apply direct pressure to the site until bleeding is controlled, so D, all of the above.
How are you gonna know when that happens?
It bubbles up.
You're gonna, what color is the blood gonna be in the tube? Dark red or
Bright
Dark?
red,
bright red?
if it's an
Oh.
artery, right?
Yep,
Looks the same to me, I'm colorblind.
that could be a problem. When it starts spurting every time the heart beats out through the end of the catheter,
There's a sign.
Refracting the IO. Syringe in it and-
even if you can't tell what color it is, it's not good.
You know,
You will need to know what color it
Because
is.
that's the part I need to see.
Um,
Okay, what, 24?
24.
You ready? When calculating medication dose, you need to know all the following except the dose on hand. See?
No, A, size of the syringe.
Okay. Electrolytes help to regulate water levels, help to regulate cardiac function, and help to regulate muscle contraction, so D, all of the
Yes.
above.
Yep,
26, most drip sets have a number visible on the package which indicates the number of drops it takes for 1 milliliter of fluid to pass through the orifice and into the drip chamber. A?
yep.
Okay, good. Which of the following can result from hypercalcemia, alterations in cardiac function?
No, hyperstimulation of neutral cell transmission.
All right, that's why it didn't work for me. Okay, 28, blank is the cause of overhydration. Unmonitored IV site, kidney failure, prolonged hypoventilation, D, all of the above.
Yep,
Which of the following is not a systemic complication? Allergic reaction, circulatory overload, phlebitis, vasovagal reaction. I put D, vasovagal reaction. 'Cause I
no,
don't
C,
know.
phlebitis.
Shift. Probably need to look that word up.
So
London, what
flood,
does it mean?
so the phlebotomist,
Uh-huh.
and then itis is a irritation or infection, so it's an irritation
It's
from
an
someone
inflammation of
taking
the-
blood.
It- putting a needle in your
Needle in
arm.
the vein.
I get irritated when people take my blood.
Exactly.
Okay.
So it's, I mean, that's the one that's, they're all complications, but that's the one that's not systemic.
Not systemic.
Could turn red,
It's
really get
local.
ugly.
Okay, so it's local. All right. A patient experiencing vasovagal reaction may present with, I put A, syncopal episode.
Yep,
13, which of the following is not found in the long bone? Tunica media?
yep.
Which is part of the vein, not the
Part
bone.
of the vein.
Not the bone. Okay. Blank veins are best used in young infants. I put scalp.
Yep,
33, which of the following is not a common site for IO insertion? Distal tibia?
no, proximal radius is
I
not
thought-
one you'd want to
I'll
use.
use that.
You'd have to be trying to find it, probably on the thumb
Proximal-
side.
Yeah, so your,
Proximal radius.
so your
Okay.
three
Thumbs-
options are
Not-
your
Thumb
Okay.
side.
here.
The tibia is actually distal tibia. Well, you would typically don't put it at the end, but
Right, the distal part is what I want.
distal to the knee, but
How you do IO.
All right, good to know. The flat bone or the proximal tibia is located distal to the tibial tuberosity?
medial
Medial.
to the midline.
Okay, I thought about that one too. I was pulling my pants up, checking out my lower, or my leg, and that was a thought, but I didn't go with it. Okay, 35, blank is a device for IO insertions, easy IO, bone injection gun, or new intraosseous device, D, all of the above.
Whoever came up with
It's a
BIG.
big,
Big
It's a
gun.
big,
I had Mark check out the NIOs. They're $100 a pop. 90 some bucks are actually cheaper than the ones that we use now with the gun deal.
I mean, that's still a better deal, but why $100?
27.
That still sounds outrageously expensive to me.
I think it is, Dan, but
I had to look at it, it's hypercalcemia, not calcemia.
Kalemia.
Hyperkalemia.
Okay,
Do you know what that means?
Potassium, not calcium.
Potassium, yeah.
Yeah, kalemia, not calcemia, is potassium.
all right.
Brandon, is your 3D printer working?
okay, we're gonna shift gears
Can
from
3D print a bone?
book stuff to hand stuff.
Mine's not working.
Whoa.
What do you need?
Come look at this. It's a IO practice device that you 3D print. And you stick a syringe in it that acts like the marrow, and then you run the IO through it. It's like the top of your bone, and you can drill right through it.
We have two of them, and we don't see one of them will do it.
Yeah, mine's not functioning right now. So.
Where's it at? Universe?
Thingiverse.
Oh, you doing IVs?
So
Yeah.
can you download the program for it then?
How many have done an IV since we had the class? Started one on somebody in the ambulance.
Amy, you did it while we were driving down the road and there wasn't even blood all over the ambulance.
Kept it neat the whole bit. I got one too, but anyway,
I have
Mine doesn't
I did
count.
it in a while.
nobody cares. I guess the thing that I see in the back of the ambulance, and I even need to make myself think about it, when it comes time to start an IV, sometimes I get excited and I grab like a tourniquet and an alcohol pad and an IV catheter, and I stick the patient, and then Brennan starts to drive like a madman down the damn road, and I don't have the rest of the stuff ready to rock and roll.
Hey, we got there fast.
Yep, we get there really quick, but I'm sitting there going like, oh hell, Amy, give me a cap, or, you know, I'm looking for stuff, and what I really need to do is set it out ahead of time. Is not wait and depend upon people to do it for me. Geez, I brought some of those little, yeah, here we go. And I think the best thing to do in the ambulance is when you're going to go to start an IV is go ahead and get out one of the locks. You don't have to open it, but I have a hell of a time with my gloves opening these things.
Right.
And sometimes, I hate to say if I open it and I miss, I waste a lock because you can't reuse it once you open it.
Right.
But on the other hand, if you got it out and it's open, you don't lay blood all over the floor of the ambulance.
What's that?
I used to like, when it was just you and I'd spike the bag and have everything open before.
Well, and that's the other thing.
Yeah.
Obviously, I hate to say I made a rookie mistake, but I started an IV on a patient. We're coming into town. I'm going like, well, geez, it's not running. I look up, guess what?
Tourniquet's still on.
Closed?
Yeah, I had tourniquet on.
We got it. That's fine.
All I had to do was release the tourniquet, and we were doing great. But there's a lot going on in the back.
Right.
You should release the tourniquet when?
I got to.
After I've threaded the catheter,
After you've got it blocked.
before I release the needle.
Oh, before you release the needle?
Yeah, because once you release the tourniquet, you don't get that flashback blowout
Less of a mess.
in the
okay.
ambulance. You can trip it, but just drop the tourniquet at the same time. If you put your tourniquet on with a little roll, and all you got to do is grab the end of it and then just pull the end and it falls off, that makes it really easy. The other thing is you got to have, and I always forget to get one out, a vein guard. Tegaderm is the other name for them. Here's a Tegaderm. You got to have something to anchor it with. In the old days when we used to do it, and I still do it this way, I would take take 3 pieces of 1-inch tape. Of course, Mark doesn't have any 1-inch tape right now. I've got some in my jacket over there because I always carry some with me. But I would take and kind of take and tear off some strips.
So you got them there ready to roll.
Yeah, so I can tape that thing down and I don't lose it coming into town when we hit a big bump. And it's hard to put too much tape on one unless they complain really loud at the ER because you tape everything over, but I believe in taping it down pretty securely so you don't lose it.
Cool thing about the ER is if you drop the patient, give them the report, and get the heck out of there, they can't really complain to you.
Well, you're gone before they can,
Come
yeah.
after you hear it.
That's right.
This is that Coban. I don't know if we had any Coban last week.
Yep.
Or a couple
Yeah,
weeks
we
ago
did.
we did it, but Coban is really handy. Obviously tape will work. Vein guards are good. So what I thought we would do tonight, is anybody in here not spiked a bag yet?
I think we did that in a B
Mandy?
class, didn't we?
Here you go. These suckers are hard to get open.
I'll hear you.
I'll give this one to Mandy. If you're not in a hurry and you look, you can actually just tear this end off.
See what you're looking at.
See the perforation here?
Oh, yeah.
All you got to do is just take and tear that end off. But when you're in a hurry and you're Jim Lash the back of the ambulance, you grab your scissors or Yeah.
So, you know, with the mask thing, it ruins
I didn't drink much
Yeah.
water today, so I'm tired.
sticking your mouth and pulling it.
Fighting it. So either way, but if you just tear those ends off, just don't poke yourself with a knife, so we need an IV, Mandy. Next thing, drip set. It's probably best to go ahead and load one of these up when you know, if we're going to a car wreck
Should I stock those out there?
and they got some bad things going on, you know, open this baby up, lay it out right away.
On
You're
on your
really-
way out to it.
You're gonna really spike this?
Yeah,
Are you gonna run it
Is that an
on?
old one?
I'm gonna have them started on me.
And you're gonna get fluids?
Yeah, I'll let you start it on me.
It's not even expired.
Oh, I already called
I'm
Tyler.
gonna use it on me. I'm not using expired
That's why
ones,
he's making
man.
sure it's not expired.
Why do you think I picked one that wasn't expired, for
Well,
God's
if it
sakes?
was only
No.
expired by a little bit, it's not.
Mark,
If we're gonna do it on you.
I can't believe Mark let you get away with this.
he left today. It was easy.
He's not here. Don't worry about it.
Mark's not here, so I just said, hey, we're just gonna donate a bag today.
Where? I just looked for it earlier.
Okay, so you got that. Before you tear that end off, or about the same time, you can hold it whatever you wanna
Probably
do.
right past the beer.
You gotta get one of these too to set it all the way up.
There's enough beer for everyone.
And there's
There's
no
enough for
easy
2
way.
beers for everyone. Probably
Same
enough
thing,
for
it should
beers.
get in there.
Yes, okay. No,
Everybody
If
gets
you
a
take your
sip.
time and look, it's not bad at all.
no liquor.
I want a liquor room.
Now, they're all sterile right now until you pop the caps off.
So this is my,
Okay. Got great veins, Amy.
okay, so I pulled this one off and then pulled this one off.
Yeah, and go ahead, pop it. Just pull it hard. There you go. Now pop that one off. Now you're gonna stick that baby in there and just mash it in there.
The last lady I did that I didn't get, she had,
Perfect.
So you've tried a
Just up to
couple
the
times?
collar, right?
Yep. Now, once you get it in there,
Three
Mandy,
ambulance,
the next
I
thing
think.
you gotta do is what?
one in my classroom.
Start it down the,
Flush the line. In order to flush the line, you gotta
Did one on my
take this
parrot.
cap off.
On your what?
You
Your,
can't force
oh, I
any
thought you
fluid
said your
down
parrot.
through there.
Your parrot's
So you
there.
drop that.
She does, Cornell.
Oh, you did? Like, she let you practice?
Okay, you ready?
It's like, sure, do it.
Awesome.
You got it right there with the roller. Ready? Okay. Shut her down.
there's still air in it.
Grumpy
Little
old
bit.
man.
It'll come out.
Okay.
Pretty much.
That's why they have these little lock thingies here. And the other lock thing we're gonna have. Okay.
So we gotta keep,
Yep. All right.
Rub that on the floor of the ambulance as much as you can while it's driving down the road.
Well, that's why I put the cap back on. Do not do that. Okay.
That's where the
Something.
generated imaging, right?
Brennan didn't get to do,
Here you go, Dan. I saved this.
Are you starting one on Brennan?
Yeah.
No.
There's a nice straight one right there. I promise to only cry a little.
Oh, I'm standing in front of the,
is Dan doing it or?
Camera.
am I sticking-
Amy's got huge veins.
You go ahead. I'm gonna watch.
Okay.
Holy crap, why
So I peed. What if I pass out? You won't have accidents. So.
I'm proud of you.
So we're good.
Don't embarrass Tyler.
I had my blood drawn last week for health fair, and it's like, yeah, give me the bed. Just
Okay, Brennan, you weren't here for this. You watched it remotely.
Oh, yeah, I watched.
We want pink ones, don't we?
oh,
pink ones are the smallest, so pink ones are good for me.
So can I tie it off?
Yeah. Use a pink one for me.
Tim says, give me a pink one.
I want pink.
Oh,
Oops.
that's gonna happen too.
Oh, yeah. Guaranteed.
You got good ones.
You wanna go for me?
Oh, good. You want to send that everything ready? Yeah. Buffalo out?
Leave me a little hair there.
Yeah.
Okay, so that's the way I do it. But you wanna do it the other way around, so that you can pull. right? Did we learn that?
As
Either
long
way,
as it,
just so you
yeah,
can pull the
as
end
long
of
as
it.
it's one little string that you pull that it.
I got
Okay.
this one available.
Oh, so that, okay, when I was trying to do it, I had it backwards.
I just put
And
mine.
I couldn't get it to pull loose, you know, with a quick snap.
If you pull one and it doesn't go, pull the other one.
I can't
Yeah, but the way I
seem
was
to
putting it in there,
tuck it
you had the other one
under.
tucked under, so I couldn't get to it.
I can't
So
seem to-
Howard, how are you doing it? Take one and.
My natural reaction was,
Now, before you do anything else though, you want to get
So I was
an
done.
alcohol wipe.
Yeah, no,
Like
go
you're tying
under.
shoes.
Did you guys take?
see what I'm saying? You
Where's
gotta
the
do
alcohol
it
wipes? Got
like that.
someone's got one.
Again, because I've been tying shoes down.
Yep.
And then if you tuck it under that way.
Then you pull that, right?
Right.
And then you stretch it out a little bit before you do it, then it'll give you a tight, because you weren't tight in the tie.
Oh, I wasn't.
And you wanna-
I didn't
Yeah,
put it
Pat it. Kind of get it to stand up a little bit.
You're not very straight, Jim.
He's not straight.
Sorry about that. It used to be. It's been stuck so many times that it's.
So I'm told that there's a method by which you can do this where you use your dominant hand primarily for everything, and your non-dominant hand
Would you go
never
there, Amy?
lets go of the patient's arm.
I don't know if she's
Yeah,
going for it.
Or would you go there?
I'd probably go
I don't think she's going for
Straight.
it.
Right, I'd go right.
right there.
Right there.
Can you pull it down and straighten it out?
Yep.
So see if
See
you,
it going
There it
right
went
here.
straight.
The only way not to.
But pat it, beat it a little bit so it stands up. Make sure you can feel it there.
yeah, you can, see mine are a little more straight.
Is it the palpation that makes it pop up, or is it the
Yeah.
alcohol?
The palpation.
Okay.
But if you
And
rub it
and they
rough
show
with
to
the
rub it
alcohol,
really hard.
that'll help
Yeah,
it
I
pop
don't
too.
know how to use this one.
All right.
Okay, now when you go in, you want to go at a slight angle.
This one has a bunch of.
We should figure out how to use it.
What do you got?
Those are the ones that
Those are different
You want
colors.
to show her, Amy?
How to use these?
No, I
There
usually
you
use
go.
a Tegaderm.
Now, you want
No one
the
knows how to use
bevel
these.
So we should just get rid of them.
down.
I think you just stick it
Up a little
over.
bit. You got to have a
So,
little bit more angle on it.
London, I think what you do is in the middle is where your,
So what do you got, like 10-degree angle there? I mean, it isn't much,
Okay, now
right?
watch. You got flow, okay?
Flash right there.
You got flash. Now you want to move, you want to thread the catheter now. You don't want to pull back. You want to make sure you're going a little bit forward with it. You got to get the catheter in.
I think it's backwards. I'm watching the
Basketball. I think I got it. I think we're okay.
Got to thread the catheter before you pull the needle.
are you looking
I
for
haven't
those
pulled the needle yet, but
Yep.
How'd you do?
I painted a little bit.
It's your pants?
Pants a little bit.
It can't be any worse.
Got to keep it straight though. You got to go with the vein.
Yeah, 'cause you're angling off this way. There you go.
There you go. No, got to go right with the vein, Mandy. There you go.
There you
Started to
go.
there.
I don't know. It was leaking out, so.
I just kind of ratcheted it a little bit back and or around, kind of side to side a little. You're getting
There
it.
you go.
You're getting it.
You can see it.
Yeah, that's the sad. I thought it was backwards. Well, it's not backwards. It's just
Got to make
not
sure you're
backwards.
still straight with that vein.
yeah, I'm right in that.
No, it's backwards. No, you're right, it isn't.
What's that?
He's
I don't
not.
know. Is she running?
You got her.
Not drifting. That means you broke it.
Did you get it?
Let's take him out
Mhm.
to the air
I'm
compressor.
hitting
He
that.
hasn't blown it yet. That's good.
Upper end. Is it fully open?
Thank you for that.
You're such a good person, Amy.
She's still working at it.
Better than running into nothing.
That is true.
You actually got it started.
Good job, though.
I'm right in that area that it goes.
Kind
funny
of gets
on.
crooked.
Hands are a little bit hard for sure.
Okay.
Do another one. Try it again.
Push the needle back through that.
Well, you can go ahead and pin it, and you got the needle out anyway. Now, what
That,
you
I don't know. I didn't
Hit
pull
that button.
you got to hit that button though.
Pull the needle back in there. There you go.
I don't think it's going to run because it might pull back a little bit. It'll start welling blood out, but
I've done that, and then I just tape the bugger down and hope that
you probably aren't going to be able to advance it. See how there's no blood coming back out of it?
Mm-hmm.
I think you went through it.
Messes are good.
Go ahead. I'll just go ahead and pull it. I think you went through it.
Okay.
Was her angle too steep?
I
No.
think he's
I
got
think
a.
it wiggled.
I think my vein wiggled on her.
Yeah,
Oh,
that's what I
rolly.
think too.
I didn't.
It was hard to follow.
See, this one goes a little straighter.
Yeah, that one Tyler shot. You can shoot that one if you want.
How does his one's on his side too? So like this one, this is
Just a
big
second,
one.
I'm stopping my bleeding.
This one right here.
You got any
This
gauze?
one right here.
No, no guts.
Band-aids?
No band-aids.
Oh, you are bleeding.
Yeah.
Jim, do we get any gauze or band-aids?
You know, I forgot to get some gauze and Band-Aids.
You're the one who's bleeding. You should have thought
There's
of
a
that.
napkin over there, though.
Here, at least do that. So we're. Cause,
Well, there's a napkin over there. You want to put an alcohol wipe on it?
yes, because I just touched you.
It's gonna hurt.
You're fine.
Now I got your blood on me. Sorry.
Oh, yeah.
There's a napkin. My wife brought the napkin, so we're good.
I was thinking about the
Mark's not paying for those.
No,
Little direct impression.
my wife got those.
I had to remind him the other day that I'm the one who's Jewish.
Looks like I started this one.
Jeez. I was like,
She probably would. There wasn't a big
I said,
mess
you
until
could
I
be
got
cheaper,
involved.
but you'd have to work
There
at it.
wasn't that big a mess until I got involved. It's like, let me look at this vein. So he's got one on that other hand that looks,
Here, we'll try the other hand.
yeah.
Then.
So that one, and then that one's good.
When did I get blood?
I'm
no,
pretty
how
sure
did
I
you do
did
that?
that. It was me.
Amy.
stepped in.
I got involved. So
So
Where
this
there's
one's-
Amy,
this
there
one's
will be
good, but,
blood.
like, I like. Wow, it was
I
poking
don't
up
like
earlier.
those.
I know. I like that one.
Yeah. I don't want to donate that one.
All right, that's fine. That one's pretty good. That one's popping.
Yeah,
pretty
those radio ones,
Who's leaving?
those don't look very
Bye.
comfortable to me.
you trying this
Bye.
on?
No,
Oh, they're
go ahead.
probably
No,
practicing.
go ahead.
You got started, Mandy. It's time to get a stick. So.
good. Dan, let me know when you're ready.
Amy looks like a good one. Look at that. You can see it from across the room.
Yeah, Amy's veins stick out like.
And they're
I got
straighter.
Amy. She's good. She was easy.
You got me last week?
Thanks.
Yeah.
No.
poke each other?
Yeah, I did.
Sure.
You did me? I thought I only got poked once and Jen
So
got me.
right here, right here it's straight, right?
You did
Yep.
Jen, didn't you?
So you want to
It's
start
going
back
No, I
here?
did do
Yep.
Jen. You're right.
Did
Sorry.
you start one?
I have. I've started a couple since our last class.
In the ambulance?
I'm gonna
On your dad.
steal one of these needles.
Sorry, Jen.
That's all right. This one right up here is good
You
too.
have practice on
She's
it?
got good veins.
He wants to
Tyler
I
wants
got
to?
big.
needle pokes.
Oh yeah, there's a good one.
You're gonna poke each other?
Got a good anacube
Yeah.
right here.
You guys should try to do it at the same time.
That one's not comfortable for a patient though, is it?
Ready to start
I-
with myself?
I think
Right
it's. I think it's as easy as that.
No, but I mean for the patient once you've got it in there, because it's in
You
your
got to keep
joint.
their arms straight.
Yeah,
It requires a straight arm after you do it.
Yeah.
Because if they bend their arm, then you got.
that's not gonna feel good,
Did somebody poke you already?
because they'll be able to feel that catheter, right?
So if there's something going on.
Well, you twist your arm, or you put your arm up, and it shuts off the flow because it bends the cath.
Right. But can't you feel that cath in there too? When, if you go like that, because it's not flexible like your arm is flexible, right?
It's not bad. I mean, it
Really?
Can I try this one?
Yeah, if you want.
I mean, there's water and coffee.
There's.
Yeah.
Water, Red Bull too.
I'm trying to think. This is probably
I don't
the
know that it's a true.
right here, probably the straightest one. But
I think an IL would probably be best.
Okay, let's do it.
or
That was a good one.
She just wants to use that drill.
Man, you're
Do you
almost
wanna start one?
got as much as your mom.
I have terrible veins.
No. No.
I'm gonna get it there.
okay.
You've done it before.
Yeah, but, or you tried one of this since then?
Tyler got it the last time.
Oh, Tyler.
That
can
same
get it.
vein?
What?
Yeah.
But she had
Jim's challenging me over here.
He didn't even grab
the last 2 weeks.
anything.
He's talking
London
smack.
Delano Jenks.
I don't need anything.
Need some alcohol swabs.
It's not gonna bleed. It's not gonna. I
Bastard.
guess we need a little. What are you talking about? I have one right here.
Your middle name is
Advance it a little bit though. Advance it some
Been
more.
watching Night Watch, so in emergency
Now go.
situations,
Now
we
slide.
could probably do it.
Because it flashed right away, didn't it?
Yeah, she got it. She hit it good.
Sharp container, we probably need to put.
Yeah, we do probably.
Just
need
don't
a
want
sharp
to pull
stick.
back
I
on
almost
you.
brought one, but I
Maintain the forward. There you
Oh,
go.
there you go.
There you go.
That's
man.
perfect.
Ow, you're haunting me.
Now put your finger there.
coming from the guy that just went on a fishing expedition.
I'll help you here. Okay.
Rude. It was fine.
Did
Now.
run, Brennan?
Get a cap
Did it
It
run?
didn't run.
right here.
Wow. I think he just drove it up. It did blow out. He was all
Let me open it for you.
Yep.
I'll try again.
It's kind of hard to open it with one hand. It's hard to open it with two.
Yeah, no kidding, because it doesn't want to open at all. Are they separated? Oh, yeah, they are.
if you can peel it with these gloves.
They were far better than most.
Now you gotta take that off.
Mine just disappeared these last hours,
Okay, now I'm gonna try another one.
Okay,
Okay.
now screw that onto the end of this.
I need some Coban or something.
I got some. I'll probably stop reading this.
I know.
Okay, good.
I had to poke myself.
Now what do you need?
For a blood type test for my microbiology lab.
You can do that, or you can put on your
Tape.
vein guard or tape, whichever you prefer.
Blood test.
Got it.
panel. That was just like a single use
I say
one.
use a vein guard.
And I got the first
Okay.
one,
Unless you just
and then
wanna
I
take
stopped
the
reading
other.
it.
Do you want to try one of these?
Sure.
Great, now
That's
I
a
can put the
Tagator.
blood type
Oh,
That's
did
my
you want to do that
favorite.
one?
Yeah, those are the favorites.
Okay, I was gonna say, I like, these look to me like they work much better.
They're a lot better than the butterfly piece of crap.
And then I don't know how, what's the best way to peel it from there?
Yep, just like that.
I have the RH factor.
Okay.
And you want to make sure you kind of put it right across like that.
I don't like those.
Let's stick that.
Okay, you ready? Stick it down. Stick that baby down.
Blood type, or like my blood
Now,
cells have a
You want to
third
take and pull the paper
another type of
part.
antigen on them. So antibodies.
Pull the paper part off.
Oh, I didn't see how that
Why
worked.
did I
Okay.
let you do this twice? You have blood on your hand.
Why'd you do that?
Perfect.
Usually the patient isn't this helpful,
Sorry.
but thank you.
We're not complaining, Jim.
Now, hook me up and run me a little fluid. Make sure you flushed it good.
Cause I didn't get it.
Let's
and I
flush
get
it
mad.
again.
I would just spit on it a minute ago and you've been fine.
I was trying
I don't
to
got that cap off yet.
Oh,
improve my.
Back up, back up.
It's going to shoot like crazy. Why don't you shut it off up there and then she gets the cap off. Here,
How hard should it be to put
bring it to the
catheter
patient.
in?
Hold on.
I always find that like it doesn't
is
go.
it up or down to shut off? Down, right?
Up to shut.
Oh, that's flowing.
Okay, down. You can feel it get tight.
Yeah.
Now, the reason you do that and you put this Tagaderm on, if you forget and spray it all over the hand, you won't get snot to stick to their hand.
Oh, okay.
Yeah, there should be a valve right. Oh, no.
Ow.
Now, does it have to puncture that or not?
No, it just has to
It
go
just
in.
slips in.
There's a little ball valve there. And you just take and thread it right in, Mandy.
I'll put you guys in the bottom of my truck.
Oops, you gotta keep turning though.
That's hard to do with those
Whoa, whoa,
gloves,
whoa,
though.
you don't wanna tear your IV loose. I'm holding on to it for you. You're good.
Got it.
I think the tape is maybe
That's
there.
basically how all of
I looked, did you get it up on the,
there, and I'm like,
well, we'll see. Go ahead and let it run, let's see what happens.
See if it leaks.
Yeah, see what happens.
Okay, it's running,
You
wide open.
gotta check right there.
Okay,
That's where you see where it's running.
right. But I was looking to see if it was leaking.
Stop.
it doesn't matter. I'm gonna pull it out anyway.
No leaks.
Well, what we're looking for is to see if it gets puffy right here. Because that would mean you infiltrated.
Oh, so I was looking to
And
see
you
if we had a
just-
leak
and-
here.
No,
Okay.
it's,
That's the thing I've had is.
you don't want to get a bump here.
Okay,
If you get a bump there, you've infiltrated.
that's your
the
infiltration.
vein. Yeah,
Okay.
Straight.
And by that you mean the catheter's outside the vein.
exactly. Now you want to take your,
So like mine.
may as well just do the whole thing, Mandy.
I was off to the left
But
a
like
little
you
bit on
can see
yours.
it, but you know it's a little deep.
And I was also reading.
Start
Yeah, that
shallow,
flash
and once you
was
Now I take this.
It was
Yep, I always put a little doohickey in it.
Oh, look at that,
And-
there,
Trying to leave
damn.
both the ports down.
Yeah, leave the ports out.
Okay.
Now just taking, whoops,
One of these days, Tyler, I'm
I'm
gonna
all
start
wound
yours.
around myself here.
Did it run?
Let's just,
Uh-huh.
Excellent.
Jim's getting fluid.
yeah, I feel better.
You feel better? That hangover going away?
Yeah. You know, I did this for Kyle before a basketball game once.
Like one army.
Because he was hungover?
experiment over
No.
here.
Oh, good.
He had diarrhea and vomiting.
Dehydrated.
Oh. As you said that, I'm thinking this was probably good that we didn't have this skill when I was in
Stop
college.
laughing, Tyler.
Yeah, there's
If somebody in the fraternity had known this, we'd have really been in trouble. Worse than we already were.
Now what happens if I raise my hand up like this?
And it's not flowing
Stops.
anymore. Right.
Yeah, you can watch blood flow back down. It's
So,
kind of fun to do when you're in the
One thing I
hospital.
do when I do my.
Now, what's wrong with the
Vegas
chamber
is
on
a
that
little
though?
bit smaller.
So it's not getting much in it.
It doesn't get caught.
Right? Do I need to put more in?
okay.
So I typically
Can I speed it up,
put
Jim?
this on the other side and give it about that size, just enough that it's not gonna kink. But
the shorter, then you just,
Cans aren't
the
bad.
less likely it is that it's gonna get ripped out.
It's okay. It's,
But you do want both of the ports downstream,
What do you want?
right? Or does it matter?
doesn't
Do we
matter.
use
Okay.
one for 2 ports on our ambulance?
We,
No.
that's whatever in there is what we
Yeah, I
use.
don't
That's just,
typically pay
actually,
attention to that, yeah.
that's planning ahead for the ER.
Just want to be
right?
careful you don't kink the tubing. See the kink you got in it? And that would stop it from running.
Right.
And that's another thing that happens is
Check.
that it gets kinked.
All right, now, what were you saying about the chamber, Jim?
That's usually where
It's wide open, isn't it?
Yeah, it's not running like it should, but it's running, I guess. So.
Well, maybe I don't have it high enough.
Or it's kinked too much.
Right
No,
there.
Right there, it's kinked.
Most fun. Don't
It's
move.
a little tight right
The
there.
biggest, easiest to hit.
There you go, it's
Even
a
as
little
much as
faster
I
now.
move around, I just.
There it's starting to go.
Yeah,
There it's really ripping
there
now.
it's running. So
There
we
you
did,
go.
we did have a kink in it.
Yep, got to be careful on the tubing.
But again, visually, this is where you're gonna look for.
Yeah, and I would squeeze a little bit more in there. I always like this about half
Pre-fill.
full. There, that's
Is,
good.
is that part of getting the bag ready for whoever's doing the stick?
So if it's full though, you wanna turn it over and press on this piece?
We'll show them what happens when it fills.
Okay,
Go ahead and
fill it all the way up.
put too much in it.
Jim, are you really feeling it?
No.
Yeah, I think you're pushing the needle back through that.
Okay,
Huh.
we're kinked again.
I kinked it to let you fill it up.
Okay.
Oh, okay.
Now
So,
Now it's too full.
all right, so now it's too full. So
Now
then you
flip it
turn
over. Squeeze it.
Squeeze the bulb.
Yep.
That piece right there, yep.
Now turn it back
And then
over.
when you turn it back
So it's
over,
about
Because
half now.
it creates like
Then
a
you can
vapor
still-
lock in it.
Not enough. You got to do it
Enough?
again.
you wanna be able to see what your drip rate is.
There. Now you're good. Now open it up again. We'll let it
So
go.
ideally, you'd like to have about what, 3/4 of an inch,
Yeah.
or
Half of it.
half the bulb.
Yep.
Remember all those times you was
Okay.
asshole to you as a teacher? This is your
I was not. It was always.
You're still alive.
Yeah, and it really doesn't hurt that
Get the
bad.
pads.
Always, yeah.
We're losing him. Get the pads.
I'm not gonna argue that at all.
I might resist those a little.
All right.
All right, now.
Let me shut you off.
Yeah, how do we take it all out? First of all, we need to
All
go
right.
get a napkin.
Okay. Good thinking.
Dan, you ready?
Well, we're gonna learn how to take it out here.
Okay.
These
All
will
right.
do it all, right?
I want to cover up these sharps though. What do you do with that?
Well, we should have a
Sharp
container. Let's get like an empty plastic bottle, like a
Can I-
water
I mean, I
bottle.
could probably
Can I
fix
Well,
put
there's
it
a
in there
paper
though?
cup,
Does that,
plastic cup.
Yeah, plastic cup works.
that gives you some protection if you just stick it in there, right? While it's laying around.
Water bottle's a great thing to use for a needle deal, empty.
Oh, okay.
This is a fire hall.
For
We don't
temporary
have
sharps?
water bottles here.
There are no water bottles.
When's the last time you saw Collins drinking water?
Ow. Ow. No one ever makes it hurt this bad, Tyler. What are you doing?
Wow, I hope that's not what your date says to you.
Gonna get that Indian Bravery Award there. Ow, ow, ow. I like something you can see so you don't ingest it accidentally, but Mandy's got one there. That looks good.
I mean, you got it.
Perfect, Mandy.
I found a half full water bottle in there, so.
Perfect.
All right, so we'll use it for that. Is that the only sharp we had?
No, we got 1, 2 there, 2. I don't know where they all came from, but somebody I think was bringing the sharps.
Well, they did a couple over there.
Yep. Throw them all in there. The nice thing about those, they retract automatically. It's
Yeah,
pretty hard
that's
to
kinda
get stuck
nice.
with them. If you leave the needle out is where you got to be really careful. I always...
And that one was the catheter that we pulled back out, right? That's what I stuck in there. Okay.
So you did a nice job. Got the tourniquet off right away. I think I helped you with that one. But anyway,
Yeah.
10 sleep. I hope you guys are practicing there.
They left.
Oh,
Yeah.
okay.
They're practicing.
Good enough.
Send me the link tomorrow, and I'll record that one too.
Okay. So
All right, so what do we
Shut
do?
off the
That's
fluid.
shut off. It's shut
I
off.
got them. They're just big.
Okay.
This is the part we don't ever do.
Not normally. Now, first thing you want to do is go ahead and take off the Coban.
yeah, I'm trying to
Yep.
find
got
the
her.
end of it.
Well,
Could have probably used that on your.
You're good. You don't need to practice on tonight.
This one hasn't been.
Brennan, you
used
need
yet.
some fluid, buddy?
You could use
Okay.
it.
I might have backflowed into this
I'm gonna
baby a
reuse
little.
this one.
No, I'm okay. I have a full bag of fluid over here.
Okay. There you go. Grab it.
You want me to do it?
Just grab that and hold that needle because you don't want to twist it with the needle in. Oh, here, I got it. Go ahead and not twist it out. There you go. Now, you got to take and
So that ball
gently-
cock seals then.
Over here.
I don't know if it has to be
Is that right,
gentle,
Jim?
does it?
What's that?
It's got a ball cock in it, so it seals?
Yeah.
Yeah.
Okay. So it doesn't flash back?
This does.
Yeah, that's what I'm saying.
So like a lot of
Okay.
times if I don't have my tubing and stuff
Go ahead.
ready, I'll just put that
I
end
got it.
on,
Go ahead and
Okay.
keep pulling.
put my, whatever the heck
Don't mind
that
the hair.
stuff's called. To tape it down and then
Okay,
I can
now-
get the rest
I can
of it
take that
sewn.
whole thing
Well,
out
here,
together,
put
can't
this
I?
on it.
So like
Ready?
if I'm by myself,
Pull.
that's what I'll do.
Straight back. There we go. Nicely done.
How's
Yeah.
your Dogecoin doing?
I sold that shit.
Did you?
I just actually bought that from the Ethereum.
We're gonna reuse the Coban.
Okay, Mark.
He's rubbing off on all of us, that guy.
Well, it was already dirty.
Jim, you look like the walking wounded.
I think it's on the last
And
go.
hey, I had a nice. I taught well tonight, honey.
You did a great job.
Put this as your Facebook post.
Yeah.
The
A
kids
night
thought,
in class.
The kids thought I didn't do a very good job.
No, I've got.
Okay. Well, who's next?
Mark, I'll let you put one on me. I'm pretty good.
Dan, you can go here if you
Dan.
want.
Well, all right.
Here, I'm
I wanna-
offering mine.
I want to try. I want to. Are the butterfly ones easier to use or not?
We got the cap for this somewhere. Did we throw it? We
Oh,
probably-
I probably put it here. Is that it?
Yep.
Nope, that's the one for the other one.
Oh, it's in this trash pile someplace then.
Yeah,
What are you
right there.
doing?
So I don't have a.
Do you want a hand or I got?
Oh, here we go.
Here.
That's what I was looking for.
You want to do a Anna Cube or you want to do?
No, I don't think I want to try one of those.
Okay. Well, my hands are pretty well done.
Andy's hands are a little better than mine.
I got pretty young hands if you want easy.
Oh, that
Hey!
Oh, look, they're straight too.
That
You should
hurt.
never have shown us that.
That hurt.
Rude!
Go ahead, sit down right there
I got
then.
these cubes out and cubes. I'll just keep them myself. No worries.
Oh, I know.
So you guys all
Love
got
you,
steak
Amy.
printed. Did you get a steak?
I have, yes.
Dan,
I've got about 4.
You're watching?
want a piece of it?
You're watching it to make
See,
sure.
this way you can coach.
All right, so
don't know what
band
I'm doing.
first, right?
Hey, let me start an IV.
And
So one thing about hands too is if you have somebody that does, like we're cutting their clothes off isn't an option, you can't get their shirt off. I've also taken and put in my band here and it works too.
oh, okay.
See, I
Is that
can't.
tight enough?
Yeah, but see, you're the same way as me. I can't.
I
I'm
see.
trying
Again,
to
I
think
did it
about
back.
how I
I
do
did
it.
it back.
You did it, but
I don't remember how
I
I
can't
do
do
it.
it under.
I do it here.
5.4 now.
See, she got it under.
And
I
that's,
can't get my feet
So I
to work
stretch
that
it and then
way.
I
that's
stick
what
it up
think.
with my thumb.
I think it's all those years of tying shoelaces. I go over, right, when you tie shoelaces,
Okay.
so I want to do
So
that again
come-
here.
Come,
If I do
come
it the
tight,
other way
come
around,
tight and go under with this side then.
exactly,
This is the one.
right?
Yep, that's
No,
fine.
Is that fine? Because then you
Yep.
can pull up?
Yep.
you
But
might
it's-
go-
but is it better
you
to
might
pull
go a little
down?
tighter.
Yeah, look,
It,
my wife
I don't
you?
know that, yeah. So stretch it, and I stretch it, yeah, stretch it.
You stretch it out like that.
And then, yep.
Okay, and again, I want to go under, so really what I want to do is this,
Yep.
right? Because then when you tuck it under, you can pull down toward you, right? Does that feel tight enough?
Yeah.
I mean, I've
Let's
done
have a
2
look.
already.
I wouldn't have lasted that long at my house.
I do another.
All right, so then alcohol swab, and we're looking,
Is that
Got a
vaccine
couple
for
of
the cowboy? Kyle, now my son was
so
told me
that one
about
right there
dance
is really
night
straight,
cowboy.
right?
You didn't have to be
And it's
21
coming
to
up
get
real
in.
nice.
Wednesday nights, you only have to be 18.
All right, so do I
But
pull, I don't want
it's
to pull
dance
down,
night.
because actually I lose
Yeah.
it if I
Now, do
pull
you
down,
Western
right?
swing?
Oh,
Well,
I do. But the last
if
time I tried to
you,
go, it was
Mandy's
closed.
probably not gonna roll,
Kyle said
because
that's a
she's
great
young
way
enough,
to
but
get
sometimes our
girls.
elderly patients
He said
will
he
roll,
Western swing
and that's when I'll
over.
kind
And
of
then pulling it
pull
down is
down
what
with her.
helps?
It just
Okay,
that's a
keeps
nice-
it from
that's a
rolling
nice
quite so
big
much. Yeah,
one.
she's got a good one, I probably won't.
All right,
You know who taught
so,
me?
all right, so then,
Mom and my 3rd grade teacher.
For what?
Who's your third grade teacher?
Swing dancing.
Actually,
Kara
it's
Olson.
better if
Oh, yeah, Kara would probably been good.
Oh, wow.
She taught me how
I
to.
give you the
That
fifth.
was a while ago.
yeah.
Well, I was in 3rd grade.
All right, so, yeah. Yeah.
Well, I remember when your,
It was a while.
I remember
Did you
when
see
your
that?
mother was
See
carrying
what?
you,
What?
That was also a while ago.
and Logan, for that matter.
Damn, you're old.
You see it?
When did Kara Hall sleep?
It's a lot straighter
The
when you did the
fist?
fist.
Yeah.
2000 something.
All right, so then take that off, right?
Yeah, that was.
About
Taken
2008 or
to
11.
break your catheter loose a little bit.
Yeah,
Oh.
'cause I remember her.
There you go.
So it had to have been
All
post.
right.
But then you always want to make sure that that tip
2010.
is
Yeah,
straight up, so you can push it off easy.
Okay, it's right in there.
Okay, and since that's so straight,
Yeah,
don't
you don't have to have a lot of, yeah,
yeah,
that's maybe a little bit steeper, so pull up on, yeah, there you go.
You're
A
fine.
little bit steeper, you're gonna go, there you go, gotta go down a little bit deeper into the skin.
Well, everybody's got some IV practice in. Tomorrow morning, 9
There
o'clock.
you go, advance a little bit more.
Brennan, you gotta remember to bring your dad's
Okay,
credit
now you
card.
should be able to advance the catheter.
He's going to buy lunch
That's
for
that
us
little-
tomorrow
that.
Mm-hmm,
at P6 Pizza.
is it coming off?
It's pushing her.
What else we doing?
Is it the whole needle going in, or is it coming off the needle?
It's coming off.
Okay,
Yeah, either one. That'll work.
so
It's coming off.
Well, why don't
when you do it, hold on to the needle with your hand and just push it with your finger.
Well, it's gonna be in this one, yeah. Just choose on it anytime.
All right.
So I got
You should be-
resistance.
No.
All right, then you're probably close enough, you should be good.
Okay.
So release that.
I'll do the transfer one.
You can go a little more.
It is MS if you want it to.
Yeah.
Okay, try now, see if that,
Let's see if I can. Okay, that released
I
that.
took it the other day.
Yep, you got a camera in there?
All right, so then I want to
You're gonna
stop
see it
that so
right
it doesn't
now,
bleed on me, right?
yeah.
The other day.
Am I
You
in
may have
far
gone
enough?
too far, you might have gone through it a little bit.
Yeah.
And then.
So if you pull it out just a tiny bit, it's probably gonna start to bleed.
Twice.
Right there, is
this
it going?
morning,
Not, that's too much.
And I was in MS 195 last night. By the
Yeah,
way,
that's what
what
I
else?
lost
I should've done
it.
MS
Give me
one
some
earlier,
paper.
so I had to get second page here.
So you got it, pretty good. You one thing about hands is you
6
will
o'clock
run
in
into,
the frickin' morning.
It was
valves.
6:11. I
So that's
heard it.
probably what
So
you,
maybe what I did, because that's the
Oh, that's
resistance
you-
that I
right.
felt.
What the
Mhm.
page time was, 6:12.
sometimes if you push hard enough, you can get it. We don't really
Can you
use
push through a
flushes.
valve?
So if you're lucky sometimes,
Okay,
but
but you don't really want to
The
do
second
that.
page at
it won't
6:12.
hurt.
6:11.
Because what they do is when, in the ER, what they'll do is flush it, so they
6:05
just take fluids and push through it, so.
First page is
Give me more
6:11, second
paper.
page is 6:19.
6:19.
Yeah.
6:11,
Another
6:19.
Sharp.
So you were just a
Get it,
little
Dan?
bit shallow.
Gave us 8
Started
minutes
a
to,
little
you
bit
know,
shallow.
wake up,
Okay.
get dressed.
You got good
Let the
flash.
vehicle,
I don't even know what the roads were like, so I just was kinda,
Hey.
taking it easy.
You'll never get one until you miss a couple.
I don't think so.
No, I think that was pretty good for a first time to say, just a little bit shallow.
I mean, obviously, he wasn't having a
To
stroke
start.
because they didn't
Here, I'll
call
get
and
some
say, hey,
more.
we gotta send this dude out.
Paper towel or something.
I think that he accidentally took too much insulin.
Sure.
Because his blood
Send me
sugar
that.
was-
Do you have what you need?
that's
I
what
was
Is this yours or
wondering
we
about
need-
that.
They
Yeah,
gave him D50, and his blood sugar was 39.
39 after D50? Wow.
So, yeah.
That
he was low.
qualifies as
so
extremely
he
low.
woke up, took his insulin, forgot he took insulin.
So,
Water shot hit his head.
Dan, as
I
you
think
came
so,
in,
yeah.
you were a little bit too low, so just kind of come in more at an angle so that
Okay.
you get good penetration. And once you get your flash,
I
then you
have
come
to
down a
use
little
the
bit.
little EMT's room.
I think what happened, though, is what happened with me with Jim. You started here, and if you just started up here a little
higher.
more.
So I
like
could have
did
been
this-
farther up.
But when I did the second one on him, I came up a little further, and I did
Okay.
better.
Okay.
So I'm,
Are you teaching Tuesday?
No.
I would say right in
It's
there. is
James.
where
I
it
know,
goes.
but he's not gonna be there. I wonder if he ever figured anything
Either
out.
one of those.
Chad's in
Probably that
charge.
one.
Are you sure it's gonna let me stick you again?
I don't care, or you can
No, I'll talk to.
stick me, Amy's really dying to get sick, I don't
I
really
told
care.
Jim told me, he's like,
She really wants to get.
apparently he's not gonna be here. I'm like, well, why
But
why does he
I
need to
think-
switch? Why can't he just?
If we have
say,
time, is it okay to
"Hey,
get
this
all
is
these
what my
things
plan
open,
was."
lay it on the
You
patient's leg
execute
or
it. That
whatever?
way,
I
somebody
used
else
to do
doesn't
that
have
and
to
get yelled at
come up
because
with
we
a
don't
plan.
always
Right.
get
He's got a
started,
plan.
so.
And then you got, and then you got
if
sharps
know
laying
I'm-
around?
If you
Is
know
that
that
the
I'm
deal?
gonna start it,
Cause
like,
Jim and I can do ours
you know
anytime.
that I'm getting ready and you're just helping me,
Yeah.
then opening that stuff is great.
That's okay.
Yeah.
Okay.
I really
next one, I
think
think, is the 30th.
you ought to try back there.
So that puts me quite a ways out there. And I'm hoping that we can get Steven
It's a
up
good
here
long
to do a
straight
burn on a weekend.
Just
You're
gotta
either
keep
really
it in
brave
there.
or really foolish.
And then I think I'm
Needles
like,
don't bother me.
I'm
But
doing
it's
way
nice
better with
to,
it.
I,
The stabbing part though.
At the end
Does
of
that not
March
bother
or the
you
one
might
in
wanna do a
May.
tourniquet first.
Yeah, I'm just looking to see.
But I wanna
Because
do
it'll pop a
maps
little bit
thing,
more with the tourniquet
Okay.
on too.
where we take
But the nice part is like
basically
having
use your
Amy
GPS as a compass and
is not the
shoot
being
that and
poked,
stuff on
she gets to
and draw it out. so
help
we
you.
can, like, get an idea of where we're headed to. There's smoke calling out there.
All right,
I think
is it
it's
tight
here.
enough?
I think it's here. Well, you're an idiot.
Which is what we always do.
It could probably be tighter,
tighter.
because it'll pop
So-
better for you.
Guys, if you've got a chance, go ahead and take off. See you tomorrow morning.
Sounds good.
Oops, I didn't see this mic on.
Yeah.
I'll be here in time by lunch.
Okay. So you bring that Capital One card.
Yep. Bring that Capital One.
Show up whenever you want.
Kinda on top of her sweatshirt, that might hang you up a little bit.
Oh, yeah, okay. Now then, is that tight enough?
We need to probably bring new.
Is that gonna be tight enough?
Yeah, I'll bring home.
That's
Feels
not
a
gonna
little
be-
It looks better.
Not gonna be sterile in the morning.
See how
You
she
know,
pops?
Let's see,
those are
let's see.
deeper though, and they're harder to
This will be
hit.
fine, it's the cap.
Well, it was straight, that's why we were looking at it.
Well,
Let's see.
when they're deep, they're hard
She's
to.
got
And you're
this.
welcome to try mine, because they're a good beginner one, because they are fairly,
Yeah, Amy's got one there on her arm that looks like a damn pipeline. Looks like Keystone X.
So if we're gonna try, see that one, but it branches off that way, so you only have a
And I would
straight.
probably start here and go this way. But, you know, it's,
Even though you're gonna hit that intersection?
yeah, I'm not so worried about, well, I don't know, you could even go in right here. Probably.
That's what I was wondering, here above the intersection.
Well, right at it. Yeah.
Add it,
You're welcome.
You want the fist to look at it better?
yeah.
And rub it hard to make it kind of poke up.
I'll never say that.
I'll get my fingers out of there. Sorry, Mandy.
You're fine.
Alright,
Hey.
that loose.
About a 30-degree
What did you just say to me?
And then I want the bevel up, right?
yep,
Alright,
so a little bit steeper.
steeper yet,
If you get an infection, that is your own.
right there.
That's pretty good. And once you get flash, then you can go down a little bit.
There's flash.
Yeah, we,
Oh,
well, so they want it to be intermittent.
can I advance it there?
Don't
Oh,
really
yeah,
put
that's
out
going
there.
good.
I
You're
need
gonna
to
have
sign
to
a
just take one of their
liability
units
waiver.
because we don't have a way to do it intermittent.
There.
Well, yeah, but, you know, the.
Am I in it?
It's gonna run.
Do you wanna see?
So,
Yeah.
we could,
Turn it
there's,
good.
there's also was not,
Don't go into the
we could have just hooked it up to ours.
You'll be fine.
It would have been fine.
I think you went through it.
Oh, it's bleeding.
Yep.
So we're on, okay, so then I wanna take this, yes? Take that cap
Well,
off.
I think those intermittent ones,
I used to be able.
they come on for a second or two, you know,
Every so often.
Am I missing something
the
here?
one that, so.
No. Hold that, I put my hand on the little
Amy,
piece
you don't want
that,
to turn that bang on her.
no, that's fine. I
Okay,
was
so
gonna
I'm
just
on
get
there.
in this. Okay? And I'm not completely sure how to use these.
No, it looks like these, but-
100 cc's or so.
I think that I think you put this, but I don't know for sure.
You
I-
put
Too
the
heavy.
white thing
piece
through that, don't you?
Right there.
That's what I'm thinking.
I don't know. I
Just
don't
pull
know.
it off. There.
I don't know how to
Show
use
us how
these.
these are done, Jim. We know
Just like that.
Okay.
But how do you,
I put it like this.
that's what I would do too.
Nobody's
Go
gonna
ahead
be in
and
here.
drink.
That's across there like that.
You got it. You even got a little cap on the end of it.
We did.
There was a.
All right, and then you'd put that on?
Yep.
I don't think they've ever hit.
Okay, and then if we had the line, at this point I can go ahead and put the line in?
Yep.
Yep.
You get the line started, but since I already used some of this fluid,
Yeah, we
we
don't
shouldn't
do
give it
that.
to her.
Now, how
Would
bad
not
was
be
that?
appropriate.
Terrible? You're not right, I mean, you're free to slug me if you want.
Oh, if
I
I,
mean,
if I
turnabout
was,
is fair
oh,
play.
don't worry, Dad.
Nice job, Dan.
If you were about to get slugged, you'd have known. Because
There'd have been
there's a
no
lot
doubt,
of learned
huh?
responses.
Dan, I
that-
walked away so I wouldn't be a witness.
Oh. All right, so let's take it out then, all right? So,
All right, get a.
Hold the white thing and pull the
we
thing
need some
off.
paper towels, so we're
Yeah.
ready for that.
No one has tried?
So we're gonna loosen this,
Hold the
yes?
white
Dylan's
thing.
tried you.
Hold it here.
Yeah, that's what I had to do. Hold the white thing and then
But
use your,
I want this loose though, don't I?
go ahead and let go underneath. Hold the white thing
Okay.
and then use your other hand to pull on that thing.
Okay.
There you go.
Gently without pulling the catheter while
No,
you're at
you
it.
gotta be mean.
Wait a minute.
Not good.
You don't want to push it forward, but yeah, I peel them back personally. That way, if it comes out, it comes out. It's not like it's a big deal.
Start eating brownies, no,
If
like
it comes out, you're taking it out
that would
anyway.
be really bad.
We just want to put this
Okay,
on.
coming back. You ready?
Yeah, go ahead. Just pull straight back.
There we go.
Oh, wow! Oh, you can punch her.
It's not funny.
It was way out by then, Ben.
Damn, push and twist now. When they scream like that.
Well, I got that on video.